started with the CUSOTA meeting for March. I apologize, we had some issues with our computer in our classroom yesterday, so I couldn't record the meeting there, but hopefully we should be able to get you everything here. Let's go ahead and get started. So first thing we talked about yesterday is that, as you guys all know, April is Occupational Therapy Month. So CUSOTA is going to organize a few tables that we're going to set up in the quad on Regis. We're going to do it Monday, April 11th from 12 to 2. Basically what we're going to do is we're going to bring a few things of adaptive equipment from the lab and other great things for OT, and really just bring awareness to OT to the students at Regis and kind of get students involved and learning more about what occupational therapy is. We'll also be partnering with the pre-OT club at Regis, so that way we can get more students involved. So just let us know if you want to help out with us. That's going to be April 11th again. So for service hours, we understand last meeting that you guys wanted to have more service events and wanted to do one with the 9 Health Fair. So we have found, Mandy has contacted them, and we have set up 3 potential dates that we can participate in. We sent out a survey asking you guys to basically fill out which one you think is going to be the best date for you, and we're just going to go off majority rules. So whichever one most people say is the best one, that's the one that we're going to participate in. The dates for that are in the survey. They are April 12th, 16th, and 23rd, and should be about 5 to 6 hours total that will be needed there. If that's not going to work for you, there's also Adams Camp, which we're going to be doing this Friday, March 25th. You're moving supplies for about 2.5 hours, so that'll be a really great way to get some quick, easy hours. And there's, again, always Power Punch Parkinson's, which every Saturday you can do that for 1 to 2 hours. You need to have the 6 hours total for Dean's reimbursement, and you need to have that finished by the end of April to qualify in time for Dean's reimbursement. Conference. So yesterday we decided that those of us that are going to the conferences here in Chicago, we are going to have a meeting on April 5th just to kind of talk about our agenda of what we want to do, which days we're going to conference, which events we're going to go see, if we're going to the dean's events and all that. So that's an optional meeting for you guys to go. Obviously, if you're not going to conference, probably isn't going to be super interesting for you. So those of us that are going to conference, we will be getting together and talking about that. And don't forget to get your envelope with the address and the stamp to give to Caitlin Pledger at conference for your reimbursement. And then I have listed here just the alumni and the dean's events here for what you are going to be doing. Just remember that if you do RSVP to these events, that you do need to go to them. There will be some type of disciplinary action for those that RSVP and then do not attend. Elections. So we just want to thank everybody that went through the process of kind of helping us figure out this elections. So thank you everyone again for nominating. Only one person was nominated for the president position. So I will still be keeping the president position for this next year. I talked about this yesterday, but in case you felt like maybe this semester you were kind of overwhelmed with school, or you just weren't really interested in being president, maybe you want to take on a different position, we will be having our elections again in September, so feel free to run for something that you might be interested for then. Okay, so now for our main event, we have our guest speaker. This is our lab adjunct from last semester. We all remember her, Dr. Angela Regier. She works at Craig Hospital as an OT. She works in their wheelchair seating and she's a mobility supervisor. So she will go into a little more in depth and go ahead and play her video now for all of us.
Hi all. A lot of our is have a perfect staffing, our patient needs that we're operating in that we're providing quality care across. A piece of what I do in terms of my role as a supervisor is providing education, not only our staff in the wheelchair clinic, but also the therapists on the floor, as well as nursing staff. There's a lot that goes into properly putting someone and putting someone in a wheelchair, and we want to make sure that all of our staff understand that at a basic level, and they understand the basic adjustments of wheelchairs so that when they're working with patients on the floor, they can set people up appropriately. So I coordinate a lot of education, whether that's me providing it myself or working with manufacturer representatives to come in and speak to therapists about different equipment that's out there, new things on the market. So a lot of that could also have to do with documentation. A big piece of what we do in terms of providing our patients equipment is making sure that the insurance will actually pay for it, and that's getting harder and harder with our equipment system. So we want to make sure that the therapist understands how to document effectively to make sure that things have their best shot at getting approved. So I also help the floor therapists with that piece. I help to keep our letter of medical necessity system updated, and so that when therapists do write letters, they're hopefully as effective as possible. I also have the opportunity to identify program development opportunities, also program improvement opportunities. So, for example, one thing that we're doing right now, I have a customer and she's helping me carry out a nursing education project, performance improvement project. Nursing staff does a lot with our patients, obviously, and they probably spend the most time with our patients out of any other staff member at CRAG. And so we want to make sure that they feel comfortable operating power wheelchairs as well as assisting people with power wheelchairs. It can be a challenging thing. They have a lot to learn, and they also have a higher turnover rate than therapists in general. So it's trying to figure out a way that we can help keep them up to speed, help provide ongoing education to make sure they feel comfortable operating all of our different equipment. We have over 90 power wheelchairs, and there's 4 different manufacturers, and so things look a little different from chair to chair. And so we're currently trying to figure out a way that we can help provide that education. So that's just one example of a performance improvement project that we're working on, and that a great institute is helping me with. So that's great. I work to ensure that we have the equipment that we need, both in our fleet of wheelchairs, as well as the equipment that we need to evaluate people's own equipment once they go home. Like I said, we have over 90 power chairs. We have upwards of 150 manual chairs. We have a variety of cushions, back supports, and some very hospital supports, different drive controls like sit-up, head array, chin drive. And so it's a lot of equipment to keep track of and to make sure that we're using appropriately, make sure that it's up and running, making sure we have what we need. So a big part of my job is also making sure that that's all happening. We have some wheelchair technicians, 3 actually at CRAG, that help us prep equipment and help kind of maintain our equipment. So they're constantly filling me in terms of what we need, and making sure that everything's running smoothly. I also serve as a liaison between the manufacturer representatives and CRAG Hospital. We are so fortunate that a lot of companies like to give us equipment so that we try it with our patients. And so that's a lot of relationship building in terms of making sure that they feel listened to, heard, that we appreciate what they're doing for our patients, which in turn helps us in getting more equipment and options for our patients. So I would say a big piece of my job is also that communication piece. And then, of course, I do have patient care as well. So the next question that Kelly asked was kind of a general outline of my day. So unfortunately, or fortunately, there's not a consistent routine to my day. It kind of goes where it needs to go. But in general, I have 3 to 4 hours of patient care, which is kind of on the high end for the rest of my job. So hopefully that'll change in the near future. But I love patient care, so I'm glad that I get to do so much of it. So I see about 3 to 4 patients a day. I typically have 1 to 2 hours of meetings, and that can be a variety of different things. We meet as a team down in Wheelchair Clinic once a week. We have leadership team meetings. We have our department meetings. As I mentioned before, I work closely with some of the manufacturer representatives, so I meet with them about different equipment needs that we may have. Also meet with different vendors on equipment needs. Funding meetings in terms of what's working well from our element system, what do we need to update, what are some common denials that we're seeing. I also have an hour or so every day for patient follow-up. So part of the patient care piece is making sure that we're doing our documentation for that. After we evaluate someone, we decide what equipment we're going to utilize with them. So we have to schedule that and request it from our wheelchair techs so they can prep it so that it's appropriate for the patient. Following up to check on estimated time of arrival for people's own equipment, and then scheduling all of that. So there's a lot of patient follow-up that happens outside of our one-on-one treatment sessions. And fortunately at Craig, they understand and recognize that, so we get time to do that within our structured day. I also have about an hour for the rest of my duties, as all those things that I mentioned before, the things that are part of my supervisor role right now, I don't have a lot of time for. So it's a constant juggle with patient care and supervisory responsibilities, but it's all really good stuff. So I really enjoy it. The next question was, what does a wheelchair fitting entail? And that is a very difficult thing to answer succinctly, but I'll do my best. So it really varies significantly depending on what the person needs. If it's someone with a brain injury who has just generalized weakness, they are perhaps ambulating part-time, but they need a wheelchair to be safe for longer distances or to be safe by themselves, that can be a quick 15 to 20-minute appointment, making some very simple adjustments, maybe putting them to a simple chair like we saw last semester together, one that folds, that they can use, to push to get themselves around. So that's one end, a very simple end of the continuum. And then the opposite end would be maybe someone with a C4 spinal cord injury who can't move their arms at all. They can move their head and neck, maybe they can shrug their shoulders, but they're not going to be able to use their hands to drive a power chair. So then we're looking at alternative drive controls and the programming that goes along with that, as well as they're going to need a lot more postural support because they can't move their body. So something like that can take upwards of 2 hours to fit appropriately, educate them and teach them on how to use the drive control, whether that's through a straw or a head array using their head control to operate the chair, or even a chin drive, and then the programming that goes along with that. So there's a wide continuum. But where we always start, which you'll learn along the way in your program if you haven't already, is we always start at the pelvis when we fit a wheelchair. When I'm teaching patients and families about the importance of wheelchair positioning and making sure that they're staying appropriately positioned, I like to use the analogy of a house. And so when the foundation of a house is off, you get in big trouble, right? You have cracks in your walls, and there's just a lot of issues above the foundation that result from that foundation being off. So the pelvis is obviously the foundation of your body. And so when your pelvis is off, then everything else from there starts to get off. And that's where over time we can start to see postural issues like scoliosis or kyphosis. We can also start to see respiratory issues if those things get really bad. There can also be skin breakdown because of all of the postural asymmetries. And so we always talk about starting at the pelvis. So when I'm fitting a chair, I start at the pelvis, I make sure we're level, I make sure we're getting a neutral pelvic tilt, and that we don't have any obliquities or, one side lower than the other, or one side of the pelvis forward or back than the other. From there, I go to the trunk, and I want to make sure that the trunk is straight. And for someone who has a, mild brain injury that maybe just needs a wheelchair for safety, they're not going to need a lot of support at their trunk because they have active movement. Versus that C4 spinal cord injury is going to need full support at their trunk because they can't move at all. And so we place what we call lateral trunk supports to help keep them stable and midline in the chair. From there, I like to go to the footrest to make sure that they have good thigh support, that they have even support throughout their legs. If footrests are too high, it puts a lot of pressure on their ischials or their sit bones. If they're too low, it puts a lot of pressure right at the front of their thighs, which can start to cause blood flow issues or, skin issues. So we look for an even pressure front to back on their thighs. We also want to make sure that we're always maximizing the amount of contact that the patient is making with their support surfaces. So that's kind of along the same lines as making sure they have that even contact front to back, but also that the foot plate is at an angle where their whole foot is touching it. Sometimes if that foot plate is angled too much and they don't have the range of motion in their ankle, they don't make good contact, and then that can start to cause skin issues as well. And from there, I go to the arms, making sure that the arm supports are at a good height to make sure that they're approximating at their glenohumeral joints. If they do have any subluxation, I also want to make sure that the placement of the pad is good. If it's too far back, it causes that humerus to go forward in the shoulder joint. If it's too far forward, then it really kind of pulls them forward and can even rotate them. So not only height, but positioning of the armrest. Then I look at the joystick if they're driving with their arm. If not, then we go to the headrest. We look at that, make sure that that's positioned well. Typically at that point, we're looking for good cervical alignment so that ear being in line with the shoulder. And then from there, we go into programming a chair if they are driving a power chair, making sure that the chair operates the way that it needs to for them and the type of terrain and areas that they're planning to be in. All of those same things apply that I talked about if it's a manual wheelchair fit, in terms of starting at the pelvis, going to the trunk, and then going to the legs and feet, and then arms. And then a lot of times manual chairs don't have a headrest unless it is a tilt chair that tilts back. So it's a really hard question to answer succinctly, so I hope that helps a little bit. I think that'll all make much more sense to you as you get into your clinicals and as you have a lecture on wheelchair seating and mobility and how to look at the configuration of chairs. But I'm always happy to serve as a resource for you in that area if you'd ever need anything. I think it's really fun and I'm pretty passionate about it, so don't ever hesitate to reach out on that topic. One of the other questions that Kelly sent was how to create and prepare me for leadership position I have now. And it's been an interesting thing to reflect on over the last few days, because I honestly don't know if I've ever intentionally thought about it, but it was a really good exercise for me to do so. And it's hard to answer because I feel like it wasn't one thing or one class. It really was the culmination of all of my classes and experiences while I was at Creighton. I tried to think of a few concrete things to tell you all. So one of the things I think that Creighton did was provide me with a strong clinical foundation, which obviously most of us are starting out as clinicians, and that's your first opportunity to prove yourself as a good clinician. And even in a clinician role, you can start to take on different leadership opportunities or different projects that you see or that come up. So I think having that strong clinical foundation was the first step. I think learning how to be a professional was a big thing, and that's something that occurs in probably every class and every clinical experience. It's not just part of one class, as you all know. So I think in thinking more about that, in terms of how to become a professional group work, I know it can be a little challenging sometimes, but it really helps to prepare you for working with your larger interdisciplinary team. A lot of what we do as therapists is working with other therapists, working with physicians. I mean, there's a lot of people on the team that you're going to be working with. And so every group project that you have helps you learn how to work with different types of people, helps you to learn to work in different dynamics. And that's, I think, a really good foundational skill for a clinician and for a leader. Also presenting, another fun thing that sometimes can be a little nerve-wracking, but you know, the more comfortable you can get speaking in front of people, I think the better off you're going to be, because as a clinician, you're going to be speaking in front of people, whether it's your patients, the families, speaking up in rounds about something, or doing professional presentations. The more practice you have and the more easy you can get with that, the better off you're going to be once you're out in the clinic. Also, in terms of just thinking about specific classes, it's been about 8 years, so I can't remember the exact class names, but I think back to my management class. I learned a lot in that class in terms of communication, adult learning, just skill sets that you would use as a future leader. We also, as part of that class, you could either do a business plan or a program development plan. And so in that class, I did a program development plan, which I think was really helpful in my current role. And I think for any leader, you know, you're always looking for opportunities for improvement and ways to grow the clinic or the program that you're a part of. And having that experience and going through that process gave me a strong foundation for knowing how to do that and how to execute something if you see a need. So when you come to that point, I would urge you to take really seriously and really think about something that you think would be a potential need that you could then carry out. The professional rotation student that I'm working with, I gave her the topic, but she's doing a program development plan for the nursing education on power wheelchair operation and positioning. And so she's having that opportunity to apply what she learned in that class in an actual clinic setting. I did the same thing for my professional rotation. I developed a OT position for the Rocky Mountain MS Center here in Colorado. They didn't have OT services at the time, so I did that as part of my management class, and then my professional rotation was actually carrying that out. So having that experience was huge. And so the program development piece, but also having the opportunity to have a professional rotation so that you could explore. I chose to do program development and community-based OT, and that was a great learning experience for me in preparation for becoming a leader, because I actually had the chance to carry out program development plan and see what you run into when you do something like that. And then also just thinking about things that I gleaned from classes that I wouldn't have necessarily thought would have correlated with what I do now, but when I think back on it, we had several semesters of community OT, and I'm not sure where that is in your curriculum or what it's called, but thinking back to that, it helped me form a lens of being resourceful, of thinking, you know, yes, we teach people what the ideal thing is in clinic, but what's going to work for them in the real world? And what are their resources? What are the community resources that are out there that can help transition, make their transition a little bit easier, or help provide funding for a piece of equipment that maybe wouldn't be covered by insurance? And so little things like that, just being resourceful. You know, every class that you take, you're going to get something out of it. And it might not even correlate directly to what the class is about, but every opportunity you have to learn, take it. Every clinical you have, you're going to learn something, whether it's learning what you like about OT and what's done well, or whether you have, unfortunately, an opportunity that doesn't go as planned. You can always learn something and grow from that experience. So, and then also the research classes were really helpful. I'm really fortunate at Craig, we have a research department. And so if we have clinical ideas that we feel like maybe aren't well represented in the literature, and we feel like there needs to be something done about that, there's support in place to help you carry out research projects. And so I think that was another really important piece of my program, and something that a lot of the other clinicians at Craig don't have as much of. And so I think that that also helped set me apart as a leader within our department, just because I knew how to do that and see the importance of it, and then the structure is there for us to actually act on it. So that's exciting. And then I think the Jesuit values, I also put back to that, and it's really great because Craig Hospital really aligns with that. They are always about doing the right thing, regardless of what it may cost Craig. If the patient can afford it, if they need it, we're going to make sure they have it. And I know that that's kind of a utopia, and that not every practice area or clinic can do that, but I think that's one of the reasons why I also, you know, emerged as a leader at Craig, is because my own core personal values align with the organization so well. And I really do think that Creighton and the Jesuit values had a lot to do with that. So how did I become interested in working with individuals with spinal cord and traumatic brain injury? I wasn't actually planning to work with spinal cord injury. When I came to Colorado for my professional rotation, I loved it out here, so I decided to stay. And Craig had an opening. I actually applied to another rehab hospital in Denver, and they wouldn't even give me an interview since I was a new graduate, which was heartbreaking. So if that happens to you, don't panic. But I bounced back from that, and Craig had an opening, so I thought, you know, there's no way, but I'm just going to apply anyway. And I fortunately got the job as an inpatient therapist. And at the time, I was really interested and passionate about traumatic brain injury. And I wasn't sure where the opening was at Craig. And I told them, I don't care, you know, I'm happy to go anywhere. And so it happened to be on the spinal cord, which I never had an interest in. I thought traumatic brain injury was so fascinating, and there are so many amazing opportunities just from my level. I had a level 2 field work at a rehab hospital in Indianapolis, and worked with traumatic brain injury and stroke. And so that was kind of where my passion for that came from. And also just in our rehab classes, learning what OTs can do for someone with that sort of diagnosis just fascinated me, the vision piece of it, the routines and structure, in addition to all the physical things and adaptations that we can help with. But I ended up on spinal cord, and I actually really fell in love with it, and it's most of what I've been doing ever since I've been at CREG. I was on the spinal cord inpatient side for 2 years, then I went to spinal cord outpatient for 2 years, and now I've been in the wheelchair seating clinic for 4 years, which has actually given me a good opportunity to do more with individuals with traumatic brain injury. So I'm still learning every day in that regard, but it's been really fun. Advice as you go into your first level 1 fieldwork in August. First off, can you believe that your second semester is more than halfway done? I bet you guys are just learning a ton. Hang in there. That'll be over before you know it. But my advice to you as you go into your first level 1 fieldwork in August would be an active learner. Don't be a passive observer. Even if it's in an area where you're not sure you're interested in, you can always learn something, like I said earlier. So just take it as an opportunity to be a sponge and absorb as much as you can. Ask questions at appropriate times, of course. Take notes and study in the evening if there's something that's brought up that you don't understand. Just really use that time to absorb and learn as much as you can, both from your clinical fieldwork educator and through reviewing, your information from your coursework. I get really excited as a fieldwork educator when I have a student who asks questions. That helps me know that you're engaged, that you're invested in the process, and it's work for me too. So it's nice to know that you want to be there and that you're taking it seriously and learning as much as you can. I think that even if your level 1, like I said, isn't in an area of practice that you're super excited about, you can always learn something. Maybe it's not even clinical skill sets that you're learning, although you will learn those hopefully, because that's the point, but also just even observing interpersonal skills and how your fieldwork educator interacts with patients and families and other team members. All of those things are what you're learning, so don't forget about those pieces as well. And also, your learning experiences in clinic will help serve as an anchor when you're in the classroom. So right now, you've had that chance to do some observations, which is great. And then as you get into your level 1 and level 2 fieldworks, you can really use what you see there and what you learn there when you're in the classroom and vice versa. So say you see something in clinic and then next semester you're talking about that diagnosis, it gives something for you to really tie what you're learning to an actual person. And for me, that really helps solidify some of that clinical information in the classes. And then also, when you're on your clinicals, take what you're learning in class and really apply that as well. So it goes both ways, but it just really helps to have some real world experience and observation to really give you a foundation for what you're learning in your classroom and put a real face or person to the different things that you're learning about. So I hope that was helpful. I'm always open to email, so if you have any follow-up questions or want clarification, please feel free to reach out to me through my Clayton email. I hope you all are doing so well. I'm going to attach a few pictures to the email I sent Kelly of Beckett. There's probably a more technical way to do that, but I'm new to this whole video recording situation. So anyway, I hope you all are doing so well, and I will talk to you soon. Okay, bye.
Okay, so a huge thank you for Dr. Aguirre for doing a recording for us. So just to finish up here, here's the few pictures that she had sent of her son Beckett. And if you're watching this online, the password is Craig Hospital. So our next and final meeting is April 26th at 5 p.m. We will have food for you, so come a little early to get some food. And again, there's going to be that meeting on April 5th for the conference if you're going. That's optional. So thank you so much for watching, everybody. I'm going to go ahead and I will see you guys later.